Good evening and welcome to Harmony Equine and Harmony Muzzle's latest webinar. We're going to be looking at Lyme disease in the horse this time. And for those who may have been on this broadcast before, we are getting it recorded so everybody will be able to have a copy of the recording and the slides together. So let's get started. The history of Lyme, we have a tendency to think that it's a brand new thing, but it's certainly been around in this country for 40 or 50 years. But there actually was a 5,300-year-old body found in the Eastern Alps, and it was very well preserved and frozen, and it showed the presence of the bacteria. So that means that this is not a brand new disease. It is currently found worldwide and is in the USA, in Europe, in Asia. There certainly are, and down in Australia, there certainly are locations where we have a lot more frequent reports of it than others, but it is prevalent everywhere in the world. Most likely it's severely underreported, even though technically if a doctor sees a human case, it is supposed to be reported. Most of those cases probably do not get reported. In the United States, the East Coast seems to have the most cases, from Virginia, where I am, all the way north. But there are cases showing up in the South. There are cases showing up in the mountains. Anytime you have a horse that fits these symptoms that we're going to talk about, consider that it can be a possibility anywhere in the world. So the Lyme bug itself is a spirochete, Borrelia burgdorferi, and it is a very intelligent, very mobile, very complex, and corkscrew-shaped bacteria. It looks and behaves like the syphilis bacteria. So some of the chronic diseases that syphilis used to produce are not that dissimilar from what's actually produced by Lyme. It is generally thought to be transmitted only by ticks, but there is evidence that it can also be transmitted by fleas or spiders, maybe mosquitoes, just about any blood-sucking insect, potentially. And I think as we explore it more worldwide, we'll see a greater variety of insects that are capable of transmitting it. We tend to think of deer and the deer tick as the main host, and that is correct. There certainly are a lot of it connected with the deer, but we have a big reservoir of it in the white-footed mouse, which is a common kind of field mouse that you see in many places. We can have chipmunks, hedgehogs, rats, humans, dogs, horses, any other creature that can get infected, maybe even every warm-blooded animal, we don't know yet, potentially can be a carrier or be infected. Some of the unfed, the nymph stages, the small stages, can become infected, possibly because they've already been on one of the hosts, like a mouse, but before they actually come to bite a human or a deer or anything like that. In some areas, as much as 50% of the adult ticks actually carry the bug, so you have a very high possibility of becoming infected or reinfected. The real key to this bug is that it adapts to everything we do. It adapts to the host, it adapts to the drugs, to the herbs, to anything we try to treat it with. And so we'll go through a little bit of the science here. It has an outer protein coat called a dicorin, and that actually hides the outer layer of the spirochete from the host's immune system, so that when the blood is still in the tick, the bug is already changing this outer protein coat to adapt to the body's immune system of the animal that's being bitten by the tick. So that could be different for the person or the horse or the dog that the tick is currently on. So it can then enter the body undetected, and then it can change repeatedly, and that's how it can avoid parts of the immune system and the drugs. And this becomes very important when we look at ways to treat it. The other thing that's interesting about it is that it communicates with other bacteria, and that is a trait that is not uncommon when you're talking about some of our very clever resistant bacteria that are resistant to a lot of other drugs. The interesting thing is that it travels fastest in collagen, not in blood. And collagen is the material that makes up the joints, the tendons, the ligaments, the skin, the eye, the aqueous humor inside the eye. And there are actually cases that have been documented in horses where there was the spirochete found inside the eye. So a uveitis could potentially be Lyme. In the meninges, which is inside the spine and the brain, and in the heart. I put the equine heart in here. We don't know whether it really goes to the equine heart. In humans, it goes very much to the heart. In dogs, it very frequently goes to the kidneys. In the horse, we really don't know if it has an affinity for the heart. It does not seem to have an affinity for the kidneys. Kidney disease staying really very rare in horses. But equine heart disease does exist, and we certainly have some unexplained deaths from equine heart conditions, and we also have some diagnosable heart conditions. So it's something to consider. It's not a major organ in the horse. In Chinese medicine, which we'll be talking about as we go through here, the liver acupuncture meridian, I look at it like the liver, the acupuncture meridians have Chinese jobs and Western jobs. So the Chinese job of the liver acupuncture meridian is to take care of the collagen, the sinews, which is really just another word for collagen, tendons, and ligaments. So it becomes very important later on, and it also becomes important when we look at symptoms, because since the spirochete is damaging the liver meridian and it's damaging the collagen and the connective tissue, then we often will see tendon and ligament injuries or soft tissue injuries that are not really explainable by the level of activity of the horse. So as it's doing all of its shape shifting and sliding in and out of the cells and in and out of the body, it forms more protective coatings. And interestingly enough, antibiotics actually can also directly make it create some of these what are called abnormal motile forms, which are forms that can hide better in the body. So we have to be a little careful with our antibiotic use as well, because we may actually be creating resistance or teaching the spirochete how to hide from antibiotics right from the very beginning. And we have to be very careful with long-term use of antibiotics. There are three main forms in this shape-shifting process. There's the active spirochete form that you've seen a couple of pictures of. There's a spiroblastic L form where it actually begins to discard its cell wall and some of those surface proteins, so it can change and get rid of some surface proteins. And then the cyst form, where it can go dormant inside the cells or inside the tissues until the terrain is right. And by terrain being right, I mean having the immune system get a little bit low means that that cyst form is ready to take action anytime. It's sitting there waiting for an opening. And that also becomes very important when we talk about managing it. So these outer surface proteins are a little bit important because our current testing in the United States is looking at some of these outer surface proteins. So you'll see in your lab testing OSP, and that has to do with the outer surface proteins that live on the outside of the bug. So the OSPs do show up as a change in the surface of the bug in response to the tick actually feeding on the blood and making its adaptations. It continues, the outer surface proteins continue to change as long as that bug is in its host. So that also becomes very important as we start to think about how we're going to diagnose it, or diagnose it and treat it. Well, some of the things that we do know, and we're learning more every day, but it isn't making it that much easier to test for it, that OSPA is present on the bug when it's inside the gut of the tick. So that is at the very earliest stage, you'll have this OSPA. As the tick feeds on the horse, then the bacteria migrates through the tick's mouth and into the horse's body, and it changes to this OSPC. So a lot of times in an early infection, technically, we see the OSPC numbers getting high. The F becomes the main outer surface protein after it's been in the body for a number of weeks. But that's kind of an undefined. We don't know how many weeks. It could be, technically, it could be 10 days or 2 weeks. There are horses that it may have been in the body for many weeks, and I see horses that I'm pretty certain have an early infection, and that yet the OSPF is raised. So it probably varies as to when it changes OSPA to C to F. We can also have these little bleb things, which are just partial pieces of this Borrelia. And those are sent out by clever bacteria like this to confuse the immune system. So the immune system gets busy attacking these little blebs, and the spirochete just keeps doing its damage because the immune system's off doing something else, paying attention to some other thing that's going on in the body. The spirochete actually also is actively suppressing the immune system. So it's suppressing what's called the natural killer cells, which are a major part of our immune system. And because it's actually suppressing the immune response in the body, it becomes difficult to diagnose with a lot of our blood tests, because our tests are designed to read the response of the immune system to the response of the immune system to the tick. If this gets difficult, if this webinar gets difficult to hear, I'm having a rainstorm here, and we will record it again later. Send us an email if you're having trouble, a chat if you're having trouble hearing it. So the immune system is, the spirochete is evading the tick. The spirochete is evading the immune system, and it goes along and it hides inside the joints, it hides inside the cells until whatever we're trying to treat it with goes away. And then, or the immune system becomes lowered. This bug can move easily from the bloodstream into the body fluids and back out. So if you remember the shape of it, this kind of spiral thing, it looks like it could be a drill bit. And so it can pretty much go any place that it wants to. It can go behind what's called the blood-brain barrier, which a lot of things cannot penetrate, and that is what keeps your brain relatively safe from all of the pathogens and all of the bacteria and stuff that are out in the big world. This spirochete doesn't care. It can go anywhere it wants to and destroy any part of the immune system that it wishes. So if we look at symptoms, the bullseye is the common symptom that gets talked about. In reality, less than 25% of the human tick bites that are positive for Lyme probably have a bullseye, and it may be even lower than that. Some people feel that it may be down around 5 or 10%. On the animals, we have got plenty of hair. We usually have a darker colored skin, and we may not see them. It also may be that we don't get a lot of bullseyes. I don't think we have any idea because of the hair. What we often see is the shifting leg lameness, where you think they're lame in the front, then you think they're lame behind. By the time the vet gets out there, they're lame in the other leg, or maybe even sound that day and lame again the next day. In Chinese medicine, we call that a wind invasion, which makes sense because it moves throughout the body. Chinese medicine is a good way to try and understand how things work because their explanations are often very logical. We can see reduced neurologic function. Sometimes these horses look like EPM horses. Sometimes they look like they have chiropractic problems. They may stumble a little bit, something that tells you that they aren't quite right and they aren't quite lame either. A lot of our mental symptoms, to me, are the key in diagnosing it. If we have a horse that's got a sore foot or a sore hock, they usually are the same mentally. They may limp a bit, they may not want to jump too much or take off out of a starting box, but they are basically mentally still the same horse. With Lyme, you generally will have some kind of mental changes in attitude, lethargy, fatigue, fatigue even when the horse should be fit, or you get a horse that starts to hate their work, or they seem to be getting stubborn, or they get irritable, something that tells you that this horse doesn't feel well. And if you have lameness, even in one leg, and they really are changing mentally, you have to be a little bit suspicious that you could have Lyme. The other thing that can happen is that they can become spooky or flighty. In my area, I'm going to estimate that 10 to 15% of the horses with Lyme become spooky or flighty, and it is actually not just a little bit spooky. Many of these become dangerous to handle, dangerous to ride, even when they are normally sweet, loving kids' ponies. They can actually become unrideable. Once they're treated, they go back to being their normal person, their normal mental state. I am not totally sure why that's happening, but we do know that there are actually 300 subspecies of this Borrelia burgdorferi, and my suspicion is that we actually have a subspecies that kind of goes to the brain and makes them spooky. Part of that is because I have some groups of horses that all get spooky. On one farm, they'll all become spooky instead of lethargic. So keep in mind that altered behavior. Humans have a lot of issues with memory deficits, brain fog, motor skill problems, problem solving, thinking through things. It's possible that the spookiness is part of this kind of brain fog, and the horse can't quite grasp what's happening, and so they become spooky because they're flight animals. It's also possible that this memory deficit brain fog thing is what's showing up more as the lethargy or the fatigue. But the mental side of it is huge in humans. The big thing that we talk about a lot is the musculoskeletal system symptoms. We have arthritis, and many other of their symptoms can come and go with the moon cycle. So every time you have a full moon, your horse may seem worse. When you have a new moon, you may have a couple of weeks of feeling better. This is particularly true of the arthritis signs, but it can certainly be any of the symptoms. The musculoskeletal symptoms can kind of go up and down based on the level of stress. So you could go off to a horse show, you think your horse is doing pretty good, come home and they're a little bit lame and they're having a relapse because the immune system has been under stress. Not that every horse show is stressed, and not that every horse is stressed by going to a show, but that's certainly something that can set them off. The level of spirochetes present in the body does not relate to the level of the symptoms. That has a lot to do with the immune system, the reaction of the bug, and there are horses who can have very high titers and levels that don't have a lot of symptoms, and we'll talk about that in a minute. We can end up spending fortunes on a lot of diagnostics between x-rays, scintigraphy, ultrasound, blocking them, and sometimes come up with not a lot of results. So go back to that mental symptom thing. If you have a horse that you're struggling on the diagnostics with and don't seem to be making progress, think about how that horse is behaving mentally. The other thing that I have noticed is that you can treat a horse, you can do something like inject a hock, which most of the time really makes a difference. And when they have Lyme, actually, you'll find that the response to that is not as good as you would expect. And that is also true with doing something like acupuncture and some of the regular alternative medicine treatments. You might have a chiropractic adjustment done, you might have an acupuncture, you might have a bit of massage or physical therapy. Normally your horse gets lots better and is happy. When they have an active case of Lyme, a lot of times you do the treatment and you kind of go, oh, that was not really worth my money or time. So that should make you suspicious that you have something more going on than what you're thinking. So that brings us to the whole diagnosis thing. The history in many cases becomes one of the most important things, is asking what the mental symptoms are along with the physical, and what all the physical symptoms are, not just the leg they might be limping on today, but how sore has their back been? Have they been stiffer than usual? Have they been interacting in the pasture? Are they standing off by themselves? Are they starting to walk away from you when you go out to get them? Little things like that can tell you that this horse is really not feeling well internally. We certainly want to rule out common degenerative joint conditions, hock issues, bad shoeing. I mean, all the normal kinds of diagnostics can and should be done. But in this history, we want to note whether we've had a poor response to the therapies for the things that we think we're dealing with. And we have our laboratory testing, which is helpful, but unfortunately, it is far from perfect. Even with the humans, where we have some more advanced tests, you can test negative for Lyme sometimes for several years before you actually get a positive test. So we have to use the data as part of the information, but not all of it. As I mentioned before, if the body's immune system did not make a response, did not make any antibodies, then we look at this test and we don't have a very good response. So we say, well, the titer or the level is not very high, so probably doesn't have Lyme. But that may be because the Lyme has been in there long enough that your immune system is really in poor shape. So you put the whole picture together to decide, not just the lab tests. The spirochete, remember, can shift. It can be difficult to find. For a little while, they thought that there was a little bit, there was going to be a nice blood test to actually culture the spirochete, but I think it kind of went by the wayside because the spirochete leaves the bloodstream and goes into the tissues, so we don't really find it there. So, well, we just talked about this. We cannot form antigens when the immune system cells are not functioning properly. Many times we will actually see, once the immune system is healed, we may see the higher titer. I would also rather see a horse that has a really high titer, really high numbers, and mild to moderate symptoms, because what that tells me is that this horse has a really strong immune system, a big response to the infection, and the immune system is working hard. So it's not always a bad thing to have some high numbers. In the States, we have the Cornell multiplex test, and I'm not familiar with what everybody has around the world, and I know we have some international people listening. But the test that we're using in this country measures those OSP A's, C's, and F's on those outer surface proteins, and it gives us at least an idea. And I still see horses that are very low or negative that clinically look like Lyme, and they respond to being treated as if they were Lyme. There is a SNAP test also that's done by the side of the horse, and that's reading the surface antigens. And technically, they are marking the viable spirochetes. So that means spirochetes that are in the bloodstream actively making antibodies, but this C6 antibody that they are measuring declines very rapidly because the bug can go inside the cells and get away from it. So you don't want to put everything onto the SNAP test. Many of the high SNAP test results that come back with a high positive probably are pretty accurate. But just because it comes back negative really does not mean that you aren't significantly infected with Lyme. You just have the Lyme that's left the bloodstream and gone into the cells. So from a holistic diagnosis perspective, no, there is no one pattern that fits all horses. And that's kind of the beauty and curse of holistic medicine. Everyone is an individual. So even though there are patterns, this kind of lethargic horse versus the spooky horse, still each animal is an individual. On top of that, if there has been long-term drug use, and I've certainly had horses come to me that have been on antibiotics for 6 months, even a year, we have complicating layers because the immune system itself becomes quite suppressed by the use of the antibiotics. We can certainly use antibiotics and support the immune system, but in many cases, these horses have not had any immune system support. We also, in the holistic diagnosis, want all of the details of the case, everything that's gone on with this horse, especially when we're doing a homeopathic treatment and we're looking at the mental aspect and how they feel. And when we're using homeopathy, we really want a detailed description of who this horse is, what his personality is normally, what his personality is now. And that becomes very helpful as we try to prescribe what we're going to do. So since every case is an individual, you really need to change what you are doing to that, adapt to that individual. The other reason that we need to change what we're doing while we're treating them is that, remember I said that this bug can adapt to anything. So just because we have wonderful herbs does not mean the bug isn't busy making a resistance to that particular herb. So we might go for a month or 2 months, occasionally 3 months if we're having really good results on a single herbal formula. But we really want to prevent adaptation to any kind of treatment, and we're going to go through some treatments here as well. We also want to really look at the vaccination issue and reduce it or avoid it. I see a lot of relapses after they get vaccinated because what we've done with the vaccine is stress the immune system, and we actually suppress the immune system for a period of time after the vaccination. The vaccination forces the immune system to respond to it, so it's busy trying to respond, and you have sometimes a 2 or 3 week period in which that immune system is not working at full capacity, which is why a lot of times the veterinarians will say don't vaccinate just before you take a long trailer ride from New York to Florida. It's because you go through that period of time for immune suppression. So what happens when that immune system is suppressed with a vaccine is that that Lyme bug that was sitting there in that dormant state goes, hallelujah, let's have a party. Their immune system's busy somewhere else. And the next thing you know, you're symptomatic. We also have a tendency to do our vaccinations in the spring, which happens to be the season of the liver acupuncture meridian. So we have the season of the liver meridian, which may have been damaged by Lyme. And so it's going to be at its weakest if it's been damaged in the spring. We have the big tick season, and we have our vaccination all coming at the same time. If you end up needing to do some vaccines, what you can do is you can check out the vaccine article on my website and sort of rethink it and maybe do it at a different time of the year, rather than right in the spring when everything's happening. There's a Lyme vaccine out there for dogs. So far, we don't have one approved for horses. There's been one study, I think, and there might be a second study coming out looking at using the Lyme vaccine in horses. Mainly, the vaccines are for the OSPA antigen, trying to stop the bug as it's leaving the tick. But when you have a bug that's this smart and can shapeshift as easily as this thing can we really make a vaccine that's going to be smart enough to change with the bug? I don't think so. And I think we've seen the EPM vaccine kind of go by the wayside for the same reason, and it's not even as smart a bug as this one. But it's a very complicated bug. So the other issue with vaccines, with any vaccine, the Lyme or the other, is that in general, with all vaccines, there is little value and there could be a real contraindication for giving the vaccine if the animal has already been exposed to the disease, because it's kind of like a double whammy to the immune system. There was actually a study from Tufts University, which is up in Massachusetts, which is in the kind of center of Lyme country, that there's no known benefit of vaccination after an initial exposure to the Lyme-causing bacteria. And that was a dog study, but an immune system is kind of an immune system. It's going to behave very, very similarly in all species. So once you've had an exposure, you already have the immune system on alert. The immune system is already thinking about this Lyme. It may not be able to do much about it, but it's definitely thinking about it. So the part that you really want to know about is the treatment. And I wish I had a magic bullet, because there is no magic bullet. What we really need is a combined approach, potentially using some antibiotics. And certainly if I'm the first person to see a Lyme case, especially if it's a fairly fresh case, I will generally use some antibiotics. Many of the top human Lyme doctors are all using them. We only have a few choices. The human Lyme doctors have many choices. If we are going to use antibiotics, we need to be aggressive. We need to use full doses. And we need to recognize that the bug will adapt to it. So if we're going to use it, be aggressive, use it at high levels, and stop I usually stop after about 30 days. I don't want to keep going. Occasionally I will. Again, that's the individual horse might indicate that another 2 weeks would be beneficial, but I'm not going to put them on it for months. If it hasn't done its job in 4 weeks, maybe 6 weeks, then I'm going to move on to a lot of the complementary and alternative medicine. Even when you're using the antibiotics, though, you really need the complementary and alternative medicine aspects, because ultimately the cure for Lyme is the animal's own immune system, not what we are giving, or not what we're trying to give to kill the bug, but actually the animal's immune system being stronger than the Lyme and keeping it in that suppressed state. So if I'm going to do the antibiotics, I will do usually 30 days maximum of the oral ones. If I feel I need more, I might want to use the intravenous, the tetracycline. Sometimes I don't think that there is one protocol that's perfect. I think different veterinarians will be comfortable with different protocols, and I don't think there's one specific one that I think is better than any other. Some people will start with the intravenous and then finish up with some oral. I think that's also valuable, particularly because you are really hitting it hard and then you can stop sooner. We do have the antibiotics suppressing the immune system, because 2/3 of the immune system lines the gut wall, and antibiotics create inflammation in the gut wall, and they affect the immune system, of which 2/3 of it is sitting in that gut wall. To me, the sort of next step, we've looked at antibiotics. I use homeopathy as one of my key pieces of treatment. There are some common remedies that very frequently work, maybe 70%, maybe even 90% improvement from the remedies, sometimes only 50%, but they make a big difference. I also do some constitutional homeopathics where I will take the complete case, the whole history, and may have remedies that are very different from some of the common ones that I've listed here. Ledum is a common remedy that you can find at almost any health food store, and its sort of claim to fame is toxic puncture wounds, and a tick bite is certainly a toxic puncture wound. But when you really read about Ledum, it describes the mental state as well as the physical state of a Lyme case, from the grumpiness to the not wanting to be touched or handled, from the stiffness, the soreness, the fact that the soreness moves around, everything like that. It reads like a Lyme case. Rhododendron is another one, a lot less common remedy, but it is often a really good one, especially if Ledum's not working. It has similar sorts of pattern. Kalmia is another much less common remedy, but it fits a lot more of the horses that get very spooky, and that might be a starting point for the spooky ones. And there are certainly some other ones. Arsenicum alb can also fit a lot of the spooky ones, but that's where this is a place to work with a good homeopath who's familiar with horses. And that is one thing that I do, is to help people figure out what's the best treatment for an individual horse through telephone consultations. So if you've got questions, that's the best way to answer them. With Western herbal medicine, there are many protocols out there. Many of the protocols are actually, many of the formulas that I use are human formulas that I'm getting. You don't even necessarily find them over the counter. Various different companies have them. And there are a few protocols out there on the web that sort of promise that everything that has Lyme will be cured. And I think any company that promises you a total cure for Lyme I would be suspicious of. It doesn't mean their product may not be helpful, and it certainly might cure some of them, but there is no one thing that's going to cure every case of Lyme. Some of the human practitioners are starting to use things like ultraviolet light and passing the blood through a machine that exposes the blood to ultraviolet light to try and help kill some of the bacteria and some things that we really don't have access to in veterinary medicine. And using some of those they are getting rid of the spirochete completely. But even then, I'm not sure we can totally get rid of it from all those tissues where it can hide. So I may use a Western formula for 2 to 4 weeks at a time and then change to another formula. I want to keep the bug from adapting to my protocol. And we do have a new Lyme protocol that Hillary Self from Hilton Herbs and myself are working on. So for 2017, hopefully we will have a nice, high quality, tested protocol from Hilton Herbs, which is a top-notch company that makes very, very high quality formulas. I use a lot of Chinese herbal medicine in treating Lyme disease. Acupuncture I use for pain, I use it for the immune system function, I use it to help build their qi or their strength, their energy levels. I use a lot of Chinese herbal formulas, again, that are put together to support the immune system, that have antibacterial, anti-spirochete action. The nice thing with the Chinese formulas is that many of them are geared specifically to cover and take care of and support the liver meridian. Some of the simple herbs that you can add to a formula or even try on their own are things like Japanese knotweed. And I think in the Northeast, it's growing like a weed. It is a weed. We also have teasel that grows a lot in the mid-Atlantic area. And maybe these plants are growing so profusely in these areas because we actually need to use them. So what you need to do is learn how to harvest Japanese knotweed and teasel and use them. Japanese knotweed might even help as a preventative. I can't sit here and say it's definitely going to prevent your horse from getting it, but if you're on a farm or in an area where there is a lot of Lyme disease, it may be beneficial to put them on some Japanese knotweed during the worst of the tick season. Andrographis is another Chinese herb that it's actually sometimes used in Western herbology as well. And that can be another herb that is very useful. Generally, when I'm adding a single herb like this, I'm going to be giving about a tablespoon, somewhere between 10 and 20 grams of the herb. And for most of these, if they're powdered, that's going to amount to about a tablespoon. And you can just put that directly into their feed. In Chinese medicine, we also have the ability to alternate a sort of spirochete killing herb with a constitutional formula, because from a Chinese perspective, the lethargy, the lack of energy, the lack of get up and go, the lack of spring off the ground if you have a jumping horse, or the lack of, desire to leave the starting gate or starting area is often related to what we call a qi deficiency. These horses, the energy gets knocked out of them, and that energy in Chinese medicine is qi. So I very often will build these horses up with a qi deficiency or a qi formula, a qi building formula. Other horses have bigger issues with pain, with the irritability, with back pain that's chronic, with joint pain that's chronic. And that we have, Chinese medicine is called liver qi stagnation or blood stagnation. And we can also have some milder forms of chi stagnation and pain, or blood stasis. Blood stagnation is usually a lot more pain. Blood stasis, a little bit less pain. But we have formulas where we can follow up as the horses are recovering and build them back up, build back up their strength, and build back up their enthusiasm for life. The probiotics and prebiotics are probably the most important thing that you can give the horses. And partly because they've had some antibiotics usually, and also because, remember, 2/3 of our immune system lines our gut. So there's probably 500 different, maybe 1,000 different bacteria that live in the gut. When we give probiotics, we're only replacing a few. 5 years from now, we may have completely different probiotics available, and we may be able to be even much more specific about how we actually treat the gut. But for right now, you need some high-quality probiotics. If you're giving antibiotics, you can give the probiotics at the same time, and I kind of call that damage control. We're not going to be repairing the gut. We're tearing it down a little bit each time we give the antibiotics. So we're just putting the probiotics in there in order to help just mitigate the damage. Then once the antibiotics have stopped, we go back into the repair stage and we continue those probiotics for a minimum of 2 to 3 months after the antibiotics finish. For some of them, we may continue on probiotics. We may even have to do that most of their life. It's probiotics of some type. A couple of my favorites are ProBi from Advanced Biological Concepts and Pre-Pro from Equilite. And the ProBi is actually a fermented live product. And the prebiotics that are in the Pre-Pro, they are actually little fiber little short chain fibers that encourage the bacteria to have a place to grow. Our immune system support is the next thing that is the cornerstone. We've been talking about the immune system and how the immune system gets damaged. A lot of our immune tonics can be expensive, and you want to select these carefully if cost is an issue. So one of my favorites is vitamin C. It's really good in the connective tissue and that collagen. It's good for the immune system support, and it's inexpensive, and you can use that as a piece of many Lyme protocols, and you'll never go wrong with it. And I usually use about 4 to 8 grams a day, usually most commonly around 4 to 5 grams. If you want to use a natural source, there's an herb called camu camu, and that's a natural source of vitamin C, and it can be nice to use natural sources if possible. The other cornerstone that I give most of the horses I work with is some immunoglobulins from colostrum. My very favorite is the colostrum EQ from BioStar because it's made from it's collected from grass-fed cattle, and there is a lot of colostrum on the market that is from our commercial, pretty toxic cattle that are either in dairy farms or I guess kept specifically to collect colostrum from. And the environments that many of our cattle are kept in really is not going to produce a healthy immune system, so their colostrum is probably going to be deficient. So grass-fed is definitely the way to go. This is a natural immune system strengthener, and it's working in the gut. So we're working at strengthening that gut immune system, which is 2/3 of our system. Another really useful and economical product that is very, very good for Lyme and all of the symptoms is Noni. Some of you may have heard of Noni juice, and the Noni juice is really not very potent and full of sugar if you've got a horse that's a little bit insulin resistant. The fruit is called Morinda, and more companies are now calling it Morinda because Noni kind of got a bad name because it was used as a big multi-level marketing thing for a while. Noni is pretty amazing. It's a pretty amazing herb. It's anti-inflammatory. It's amazing for the immune system. There's even a lot of cancer research going on about it. It's excellent in the connective tissue. It's excellent for sports injuries. There's a lot of sports teams that actually are using Noni as one of their primary anti-inflammatories. And I often use it as a concentrated fruit leather, which is easy and inexpensive to ship around, and it's fresh, raw Noni, not fermented. So I keep that on the website. I may be sourcing some powdered Noni. It's been very hard to find. Sometimes that's a little bit easier to feed the horses. If you have got my email newsletter, we'll announce it in that when and if we contact a company that has really high quality. There's a lot of this that's not grown under very good conditions, and I'm looking for organically grown, clean product. In Lyme cases, I will often use more than the normal dose of Noni. And the truth is that you could feed a whole packet of Noni every day if you wanted to. You actually will not harm the immune system. It's pretty amazingly safe that way. Many products, if you give too much, the body really can't handle it. But most of the time, 2 to 4 times the normal dose. So twice the normal dose can be plenty. You can also use Noni topically on some of the sore joints, and there are Noni products, Noni lavender lotion that I keep on the website, and an icy heat one, which actually will penetrate a little bit better. But they both can be very, very helpful. Sore joints, tendons and ligaments, things like that. We talked about Japanese knotweed a little while ago, it being a very useful single herb to give. Cat's claw is an herb that has a lot of press in the human end of things. My personal experience in horses has been that it's not nearly as useful as Japanese knotweed, but it certainly is something that you can try, and you're going to see a lot of information on the human sites, which is one of the main reasons I put it in, so that I could bring up the fact that it may or may not be as good as it is in people. Siberian ginseng, Eleuthero, is a very useful single herb if you want to use it as a single herb to reduce stress, to keep the immune system in better shape. And I will usually use that in a formula called APF, and we'll talk about that a little bit later because we have to manage stress. And it's a very good stress management formula. And the idea behind stress management is to keep the immune system happy. Usually I use, instead of just single herbs, I will use the herbs along with the rest of the program. Omega-3 fatty acids are easy things to add to your horse's diet, even if you're not totally convinced you have the right diagnosis. These are things that you'll never go wrong with. They're anti-inflammatory, they support the immune system, they support the connective tissue. The research on omega-3 fatty acids is phenomenal. And you can use whole flax. Horses have teeth, they can grind the flax up. You can use a stabilized ground flax, and it needs to be naturally stabilized, because if you just buy a bag of ground flax and stick it in the barn, it starts to oxidize the minute that it's ground. And the companies that sell the stabilized ground flax, Advanced Biological Concepts is one of them, they are stabilizing it with things like vitamin E as they're grinding it. You can also use flax oil, you can use hemp oil. Those oils have to be refrigerated to stay useful, or they are heavily preserved. So if a company sells you an oil and says that it doesn't have to be refrigerated, then you need to find out what they're using to preserve it, or you just assume that it's probably rancid and you shouldn't be buying it. Hemp oil maybe will become more and more available in the States now that many states are legalizing the growing of it. Hemp is a fabulous oil source for the omega-3s. You can get hemp seeds sometimes, and again, these have been harder to get, except in small, expensive packages at the health food store, but that may be changing. And I think we need to be looking at, and I'll be writing about this in the newsletter as the year goes by and I do some research on it, but actually looking at the hemp, the concentrated hemp, which has what we call the cannabinoids, which the research is in the medical marijuana field, but the hemp itself does not have the THC. Hemp does not make animals or people high, and so it's legally sold across state lines now. And the concentrated hemp oils with CBDs or cannabinoids are also immune supportive, anti-inflammatory, and I think are going to be very useful in our Lyme treatment. Chia seeds are another great source of the omega-3 fatty acids. And I think chia seeds they're very stable. You can keep them in a barn really easily. They don't need to be ground. And they're a great addition to your horse's diet. And you can change. You can use flax for a while. You can use hemp. You can use chia seeds. You don't have to use the same thing all the time. Medicinal mushrooms are another favorite immune system support. They're anti-inflammatory, tremendous amount of research on the use of mushrooms, lots of support for the connective tissue. They're being used for arthritis, even just regular arthritis, not Lyme-based. And the most common medicinal ones that we're going to see are the cordyceps, the reishi, the maitake, the shiitake, and the turkey tail. And different combinations of those can all be useful. One of my favorite easy to access mushroom